All right, guys, let's pivot here. Let's talk about how do we integrate RTLS as part of daily workflow and organizational culture.
There are so many questions that come up around what the system truly is measuring. We've talked about several different good uses of staff tracking. That's great until some nurse gets concerned they're going to track how long she's taking in the restroom or a smoke break or some other thing that will be misused. Communication and setting expectations, like every other management function in our lives, is important. Letting them know how the tool will be used and establishing trust. Trust is the foundation upon what much work is laid.
Wow, that's a great point, Todd. I want to bring Paul and Ali on this.
I'm going to overlap a little bit, but maybe more to emphasize it than anything else is that, we talk about trusting the technology, but the staff need to trust the culture. You blame the process, not the people.
Ali, this is such a significant, definitely want to hear your vantage point from a Henry Ford perspective.
Yeah, privacy is a huge concern for many different reasons, right? For staff as well as patients. So I think, like Todd mentioned earlier, having very clear communication and expectations is extremely important. The other piece is doing a series of roadshows so you can illustrate the value of the technology to different groups. That goes a long way. What will I get out of this beyond the big brother component that we're concerned with? So I think just being really clear with that is a good way to get people to adopt and start using the technology.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malcurry. I'm the Managing Director at Lighthouse Health Tech Advisors. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint. Today, we're going to be discussing next-generation real-time location systems. Now, legacy RTLS was about tracking assets and knowing where things were. But RTLS 2.0 is about intelligence, understanding why things move, predicting what teams need next, and connecting those insights back into care. But here's the harsh reality. Most hospitals don't know where their critical equipment is. Care teams spend exorbitant amounts of time searching for equipment instead of caring for patients. Beds go missing, pumps disappear, and sometimes patients wander. To help us unpack this, I'm joined by three health leaders who've taken RTLS from concept to measurable results. We have Todd Frantz, a senior technologist at AdventHealth, who's led numerous RTLS deployments that have been optimized to support clinical and non-clinical workflows. We have Ali Youssef, Director of Medical Device Security at Henry Ford. Ali's focused on IT projects that are at the intersection of technology innovation and patient safety. And finally, we have Paul Zieske, principal at the consulting firm of Why Where Matters. Paul helps hospitals use location awareness to improve patient flow and daily operations. Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode. So with that, why don't we get started? As I mentioned before, hospitals lose thousands of hours every year hunting for critical equipment. Legacy RTLS provided dots in a map, but little context. Now with RTLS 2.0, systems are able to pair location with workflow, safety, and staffing data, enabling real-time decision-making. Todd, I'd like to direct the first question to you. Is RTLS considered a hospital IT spending priority now? Why or why not?
RTLS is absolutely a priority. It's part of the plumbing. 20 years ago, we added Wi-Fi as part of our expectation for every new building, every new refurbishment. RTLS is at that level with us today. Everything of significance that comes with a timestamp should have a location stamp based on the application appropriateness. So we consider it absolutely part of our world, and we base many applications and processes, both clinical and functional operational processes on the use of RTLS.
Right. Ali, why don't you join in here and maybe address some of the real costs and sticking with outdated systems instead of upgrading?
Sure, yeah, you end up missing out on quite a bit because essentially the traditional way of deploying RTLS and location-based services was very siloed and focused on individual use cases. So it's really difficult to have an ROI when you're focused on one use case. You really need to view this as a system. And I think if you look at it from that perspective, you miss out on things like advanced integrations, taking advantage of the latest technologies, and ultimately your RTLS platform becomes overpriced over time because that cost is going down. So it's really a disservice to your institution to not to be looking at the latest and greatest sort of offerings in that space.
Hey, Paul, why don't you join the discussion here? How are hospitals using location data to improve workflow, patient flow, and performance, especially if you get beyond departmental deployments and you start to deploy this at scale enterprise-wide?
Right. Yeah, I think hospitals are realizing that the data that they have now from their core systems isn't really the quality that they would need in this future with AI, right? When you think about button presses and data entry, it's just like Todd said, that timestamp and that location stamp add the resolution and add the fidelity to the data so that when you start to be able to train AI on it or show it to AI for analysis, then there's a world of insights that are open, and they're realizing most certainly when they start to talk to these AI vendors that they're going to tell them the first thing they need to look at is the data, right? So, yeah, I think that, that's probably the starting point around where this is going to go from a workflow perspective. There's a lot of other use cases, we have out there that aren't directly tied to workflow, but I think most certainly with workflow.
Well, maybe we can dip into that a little bit later in terms of what some of those other workflows are. Mm-hmm. So let's transition now and talk about, where RTLS is delivering fast wins today and where hospitals are still tripping up as it relates to RTLS. Ali, where do hospitals tend to miss safety and workflow problems for which RTLS could help identify?
Yeah, it starts with simple things like even par level management, having the equipment you need in a timely manner, when you need it. And one of the other areas I think that I've been focused on lately has to do with Duress, ensuring that you have a platform where our providers have a way to reach out and notify the local police department if they're encountering some sort of scenario, where they need help. So I think that's the low hanging fruit there, but to get a full realization of this type of platform and make, the most use of it, I think you have to take it to that next level where you're really getting information in real time that has context tied to it, as some of the other speakers had mentioned earlier.
Maybe you can elaborate a little bit on the context. What kind of context would you need? And what would be the value in terms of actually deploying those types of solution and, enhancing decision-making?
Sure, yeah. So I'll give you an example. Like from a robotics standpoint, for example, if you're looking at deploying new robots in your facility, understanding where the robot is, being able to anticipate where it's going, and being able to establish sort of a timely handoff as needed would be one good example there.
Okay. Hey, Paul, where are you seeing, in terms of RTLS use cases, where are you just seeing the biggest wins today? Is it possible to generalize, or is it more institutional based in terms of the opportunities they're going after?
Yeah, and I go back to what Ali had pointed out, is that the duress and employee safety is top of mind with the customers, and it creates a point of entry for, I don't think it was very comforting to hear Todd describe his RTLS implementations as part of the plumbing, but they're still, not the market penetration that we'd like to see out there with RTLS and location-based services in general. So, creating that kind of exposure from even if it is reactive, it starts to get them to experience that domain, the location-based services domain, well enough to start to build that domain knowledge that's going to allow them to play this game as it gets more complicated. Because we all know, we've been doing this a while, and I like to describe it as playing chess, right? Because one move opens up another move. So quite often, it's that if they have something that is a reactive entry point, it's still going to allow them to to be able to understand and get ready for the next move, so to speak.
Are we migrating past departmental deployments? Are we starting to see enterprise-wide standards developing across larger health systems? Todd, you may be able to chime in here as well.
There are many tools for many different jobs. We've had a enterprise platform RTLS solution for a long time that serves a variety of different applications, from, staff tracking, which leads into staff duress alerting, which leads into nurse call integrations, which leads into other things. And then you look at the whole asset management world and all of the different streams that diverge off of that one flow. Each of these can have many applications based on the same enterprise grade platform. On the other hand, that tool may not be the right tool for every job. You may say, we have a specific use case where we need to measure this. It's worth funding ultra wideband in the ED or in the operating room for measuring this high value process. It's worth funding some other tool for this specific process, because it's going to fit so much better and give us the data that we truly need. I'm not saying that you have multiple enterprise overlays all spending heavily to cover the same space, but we all know there are many different jobs that require many different sizes of screwdrivers and sockets and whatnot.
Right.
So yeah, there's a fit for almost every task if you really want to accomplish it.
What about at Henry Ford in terms of standardization? What are the applications that are being standardized on a enterprise level, and what are some of the emerging departmental applications that are being deployed?
Yeah, so staff duress is one of the big ones, I think, that has seen a lot of traction, asset tracking at a high level. And really now we're starting to explore this notion of a digital front door and really catering to the patient from, before they come to the hospital all the way through the entire care process. And that leverages different types of technologies. But as Todd alluded to earlier, as you build new hospitals, this is a foundational part of building the institution. Like intelligent lighting, for example, is just a given. And that has a plethora of sensors, you could use for location tracking. And there are many other examples like that. So the idea is to keep it kind of as open source as possible so you can take advantage of all these different technologies that are being overlaid, in the facilities.
Is there any one specific? Go ahead, Paul.
I was going to jump in. Well, Ali and I were talking about this recently, but there was an announcement coming out of Open Epic where wayfinding was going to become a part of my chart. And I doing what I do, right away, I started reaching out to some of the vendors and that are involved in it. And it is going to be indoor positioning. So it's not just going to be from the patient's door to the parking to the hospital, but they're going to be using indoor positioning. So just like Ali was saying, this digital front door now, takes on a much more high fidelity meaning when it comes to location services for us. And I think it really opens the door to broadening. When we were talking at the beginning about RTLS 2.0, I really look at it more as location-based services 2.0. Okay? So how do we expand out of tracking using these technologies into using things like GIS, right? This idea of indoor GPS and these additional technologies. So I was very excited to hear about that. And I'm glad you brought it up, Ali.
I had a medical appointment and they built so much and there's no parking anywhere, right?
Right.
So what happens? I came plenty of time. I was 15 minutes before my visit, but there was no parking. I had to park 15-minute walk away, and then wayfinding, trying to find my way to the that specific medical building was a really onerous task. Yeah. All right, guys, let's pivot here. Let's talk about how do we integrate RTLS as part of daily workflow and organizational culture. Todd, let me direct this first question to you. Can you identify some of the cultural barriers encountered when we're embedding RTLS into daily workflows?
There are so many questions that come up around ignorance about what the system truly is measuring. It's collecting data. What is it collecting? Who's going to see it? What are they going to use it for? We've talked about several different good uses of staff tracking, duress, and other things. That's great until some nurse gets concerned they're going to track how long she's taking in the restroom or a smoke break or some other thing that will be misused. Communication and setting expectations, like every other management function in our lives, is important. letting them know how the tool will be used, and establishing trust. Yes, the data could be pulled out of context, but I, as your manager, I'm not going to do that to you. And my boss is not going to do that to me. We're still good people. It's not a huge sounding thing. It doesn't seem to be rocket science, but it's difficult. We all have our personal foibles, and trust is the foundation upon what much work is laid. The other side of that is that for many teams deploying location services, they don't get it right on the first application. I want to measure this, so I deployed this instrumentation. It's not measuring the metric I wanted. I call it back in. I redeploy a little more intelligently now that I understand more about my business problem. Now I find out there are these 5 exceptions that I didn't know about in my business problem. I redeploy for the 3rd and 4th and 5th time until I really, truly understand the business problem and who's taking part. That doesn't show well to the staff with whom you're working. So again, trust goes both ways. Education goes both ways. Truly learning about the process your people are performing before you try to instrument it shows that you care and you want to get it right.
Wow, that's a great point. I want to bring Paul and Ali on this because I think it's is a very significant issue as it relates to culture and change management. What do you guys think?
Yeah. Well, I'll jump in. I would say the successful implementations that I've seen, the tools were built into the workflow, right? So they're not just bolted on. I call it getting it out of the tool crib and onto the tool belt, right? And that means you have to be open to changing the processes, right? Not just integrating it in directly into the process. You need to look at the capabilities that you've been offered by these new systems and then be open to actually changing processes. One anecdote is one of the hospitals I was working with actually assigned, they had a small team, they called them the location team. And they brought this team in because they wanted them to be the experts, not on how to maintain the systems, but how to find things using the systems. And they were very effective at that. And you don't see that everywhere, right? That was really interesting. And going back to what Todd said, because I'm going to overlap a little bit, but maybe more to emphasize it than anything else is that, we talk about trusting the technology, but the staff need to trust the culture. And, I worked in air traffic control systems during the time when they started to change the culture, right? And this was I'll date myself, but back in the early 90s. And there was a dramatic shift in safety and quality that came out of that. And, I like to bring that up because we think about our litigious environment that we work in healthcare. It's no different in aviation, but they were willing to do that. And I think it's the same thing. You blame the process, not the people. And it's just like Todd said, you're going to see maybe that, you're going to see less of that if it's something that's built into the culture, right? You're going to see less of blaming the people, for instance, right?
Ali, this is such a significant, definitely want to hear your vantage point from a Henry Ford perspective, particularly around the nursing staff, right? It's really kind of hard to change workflows, right? How do you get enough buy-in where they embrace and they don't try to sabotage the project?
Yeah, privacy is a huge concern for many different reasons, right? For staff as well as patients. So I think, like Todd mentioned earlier, having very clear communication and expectations is extremely important. The other piece is doing a series of road shows so you can illustrate the value of the technology to different groups. That goes a long way. What will I get out of this beyond the big brother component that we're concerned with? So I think just being really clear with that is a good way to get people to adopt and start using the technology. And once if it's truly valuable to the group, they will start using it. Something like Duress, for example, for ED nurses. If you look at the OSHA studies, it's appalling, the statistics. So it's something that's really helpful for them to have. And because of that, they will use it.
I've noticed that in the at Stanford, which is right around the corner from me, they have all these signs about duress and what they're expecting of patients. Right? So it's a two-way sword. One is from a clinician perspective about what they're willing to tolerate, and secondly is as a patient what they're expecting from you. And your presence within the organization.
And, it's when you see it, you're shocked a little bit. You're right. Do we really have to remind people of that? But it's a situation in that we exist in. And, it's culture, just like you said, it's culture internally, but it's most certainly cultural when it comes to, the patients as well.
Yep.
Hey,
Yeah,
let's
I was
pivot
shocked
up.
the first time I saw that first OSHA study on nursing and how dangerous it is to be an ED nurse. I was taken aback. I did not realize it was such a dangerous job.
Mhm.
Well, that's why they ask you the question, have you thought about killing anybody in the last 24 hours? I've never didn't know that was a
Right.
question.
Right.
No.
All right, let's talk about data integration. Why is it so challenging to get RTLS data integrated with existing hospital systems?
I can get that started. I mean, I think one of the barriers are the vendors themselves. A lot of times it's a wonderful idea, a great system. And then when you start asking about integrations into other platforms, or, hey, can we get a single pane of glass with all these inputs? The answer is no. You need to use our platform. So I think that's one of the challenges. So just having different vendors embrace, just opening up some of these standards so that you can have interoperability between different platforms and systems. Because like I mentioned earlier, the sensors for these types of platforms can exist in many different ways, right? From integration into lighting to independent beacons to there's 100 to integration into your Wi-Fi infrastructure, for example. So you want to be able to make use of all of that. And I think that's one of the challenges, is making sure that it's open source enough where you can do that.
Todd, what do you think? Any thoughts on this topic?
If I had $1 for every vendor who said integration is easy, just have everyone write to my API, we could all retire.
Agree.
If RTLS is going to be a serious platform in your world, you need to have a good relationship with that vendor, not just a transactional dollars relationship. They need to understand the value you are placing, the strategic value on their platform that you're going to use for all of these applications. You are going to protect my nurses. You are going to keep patients from wandering. You are going to perform these important functions in my environment. We need to be able to work together. I'm going to come to you and say, I have a line of business that would like to do XYZ thing. I need you to be open to that conversation. I'm not going to ask you to develop a lot of one-offs just for me. But if there's something you say, I've got 5 other customers asking about that, maybe we can advance that conversation. It doesn't have to be a formal partnership, but any vendor that you're developing a strategic platform on, someone who you're really building your business on, you need to have an open relationship that you can have a conversation.
Well, what about the big boys, the big EHR vendors like Epic? Are they open to opening their system up to enhance these next generation solutions?
They're open to listening to market demand. They have their roadmaps. Every development company has their plans, their 2, 3, 5-year roadmaps. But if enough customers step forward and say, we're really interested in wayfinding, to Paul's point, we're really interested in something else. Epic creates what their customers need. That's pretty much what most companies do, is create what they can sell to their customers. So they'll listen. They may not say, okay, you're number 27 on the list, but they'll listen.
Thank you, Todd. This is a really important topic. Paul, do you have anything that you'd like to add to this conversation?
Well, I do. I'll just touch on the topic of AI. I think what AI is going to allow us to do is kind of create wrappers around some of this data and some of the interoperability challenges that we've had in the past. I'm not going to say they're going to disappear, but it really does open up some doors. So I think that because in AI's challenge, people always talk about what I can and can't do, and it always amazes me when people say AI can't do that, because AI is moving so fast at any time. If you make that statement, you're likely to be wrong a couple days later, right? So I think that it really comes down to, being able, just like Todd was saying, understanding your data, understanding where things are going, with what you're trying to do out of that, and then looking at it, I call it agentic, right? So how, from a process perspective, do we represent that process as an agent and start looking at, how that translates into the needs for the data to actually create outcomes.
Can you bring this down to layman's terms, in terms of when you talk about the AI wrapper, what does that look, what does that translate to? Maybe you could give a couple examples.
Well, so I'll try and I always describe agents. Agents are, really kind of a simple construct in that they can sense and perceive, think and decide, and then act and observe the outcome, right? So when we start to see agents get more mature, and, the AI is just one component of the way that an agent operates. So when these agents, can you think about just everything I said? It is how humans actually operate when they're operating in a workflow. When we can start to blur the lines between these components of automation that are embedded in the workflow and actually the way that we do it, we can swap sensing, human senses, for RTLS, right? If we have people that are observing. So if we start thinking that way, where do we need intelligence, right? Where do we need decisions? Where do we need actions? Just like Ali brought up the robots, right? So the robots essentially are swapping out for a transport. So when we start thinking that way, I think that's when we're going to find new opportunities to address systems in that regard.
Excellent.
Hopefully I don't know if I succeeded in the layman's terms.
It's really important. Everybody's talking about AI. What do you guys think? Todd, Ali, what do you guys think as it relates to integrating AI into these next generation solution? Is it happening right now? Is it more future?
Well, one of the attributes about RTLS systems, platforms, whatever you want to call it, applications, they have the potential to generate a lot of data. And it may turn out, as I said, you may measure the wrong thing your first time at bat. You may even measure it incorrectly your second time at bat. Don't throw away that data. Cloud data storage is cheap. Keep the data. Make notes about what the data is and the circumstances under which you collected it, and keep it. 2 years from now, you may be doing a study and you're just knocking out RTLS applications left, right, and center and doing a good job at it. And you say, wow, we're going to approach this workflow. I wish we didn't have to spend 2 months collecting the before case. Wait a minute. We did that 2 years ago. It may not be perfect, but can it accelerate your efforts? Can it make it move forward in a way that you may not have thought of because you can go back retrospectively and look at data? We've been surprised in our organization over the years how many times we've been able to use previously collected data. Sometimes we aggregated it on a daily basis or weekly basis or something, but we kept it around because we knew there might be value and the data storage was inexpensive.
Yeah.
That what AI needs is a lot of data to find patterns, to find trends, to analyze and say, you've always been on this line, now you've got this outlier. Okay, it's hard for a human to find that over a long time, but AI can do that in ways that humans don't. Having that resource that we've not classically had, you don't have a lean black belt out there with his checkboard following nurses around every day for 3 years. But they are wearing a location badge. Just in that, you may find amazing resources when you go to do those retrospective studies to build your platform for future-looking work.
Do you have a data science team that's analyzing and determining the right use of the data? Is it the vendors that are collaborating with you guys? Where do you come up with the ideas and how you leverage this massive database of information and data?
So we do have a data scientist team, and the way we think about AI is in the AAA concept, which is analytics, automation, and AI. And so AI it's one arrow in the automation quiver. To Paul's point, like AI alone is useless, right? If you don't think through the entire process and exactly what it is you're trying to automate, it's just a tool you can use to help augment and automate certain functions, right, within that workflow. So I think it's really important to look at it in that context, like a AAA context, not just as AI for the sake of AI.
Excellent point. We're at the tail end here, kind of what I call a peer challenge. Lee, I'd like you to put a bold question on the table for Todd and Paul on where RTLS is headed over the next 12 to 18 months. So feel free to put anything out that you think might be of interest to our audience. Sure. What do you have for us, Ali?
So one thing that has captured my interest quite a bit lately is computer vision, right? I went to HIMSS last year and I saw a bunch of different vendors with intelligent camera systems that are able to delineate, if they're looking at a human or different objects in the room. So I'm just interested in your perspective on how computer vision is going to impact the location-based services space. How will those two things impact each other over time?
Wow, that's a good question. I'll tell you why. I've been partnering a bit with the Digital Twin Consortium. One of the folks that works on creating digital twins in hospitals, he actually works out of Australia, but he works closely with Singapore. And they have a new hospital coming, and it's going to be in 6 years now. And they're going to use exclusively computer vision. And initially, I thought they're really missing the target, right? Because I look at it as context fusion. Just like Todd was saying, you have all these different types of sensors that give you certain components of context that you can put those together, and you can use the AI to analyze it. You can find things out that way. But the more that time that I spent learning about the opportunities that they have of truly well-designed computer vision integration, things like they call them April tags or fiduciary tags that allow you to be able to track things where they're at. Another thing that was super interesting about that is this idea, it's called human activity recognition. Okay. And so what it does is it abstracts a human, right? It doesn't need identity for that, but it can identify what somebody's doing, whether they're turning a door handle or they're moving or something like that, right? And it just goes back to, again, what Todd was saying. People need to be transparent and understand that they aren't tracking your identity. They're trying to see if you dropped a sponge on the or scalpel on the floor during a surgery or something like that, right? Some safety events. But those kind of things open up to, kind of the next level that we look for in location is not just what is a location telling us, but what is it telling us about what is happening, right? Situational awareness. That's where I kind of, I pivoted. First I was like, it didn't seem to me like a good idea. But then, when you look at where it's going, it's most certainly in 5 or 6 years. It seems quite an opportunity.
Todd, what do you think about this idea of computer vision? What comes to mind to you?
I'm afraid I'm an engineer by training, so my first thought is line of sight and how do I get enough cameras or sensors or whatever to be able to capture all of the significant data. Obviously, they have smart people who are going to work through little details like that. But there are so many opportunities if you step back, instead of saying real-time location services, RTLS 1.0, Paul's comment about talking about location-based services, whether it's in real time or not, being able to do retrospective, being able to look at patterns over time. If I can tell this provider went into this emergency department procedure room, exam room, came out, went to that cupboard, reached above his head or reached below his knees, and he did that exercise 17 times in an 8-hour shift, or 12-hour shift. Why is he doing that? How many steps is he taking? How many motions is he making? Is there something he's doing where we can change where we store equipment that will save him steps or save him bending over?
Hey, that's really insightful, Todd. I think you're right on the money. If we're in the operating room, when is the start of surgery, the end of surgery, and what are the micro tasks in between where we can optimize and apply lean technology or lean methodology?
Where can we reduce friction?
Yeah, they're doing that now. So there are the vendors out there that are using computer vision for exactly what you're talking about. In the operating room, it actually becomes a benchmark for the kind of things that you can do outside the operating room, which is interesting.
And we tend to talk about these services in an inpatient environment, but we don't all spend most of our healthcare dollars in an inpatient environment, and certainly not our healthcare time. How long has this person been sitting in Dr. Smith's waiting room, waiting to see the doctor who's now 45 minutes late on appointments? How long has whatever other customer service events that should inform us about the way we're running our operation in a manner that makes significant changes in our patients' perceptions, in our customer view. There are many other opportunities like that where just scanning, where do people sit in the waiting room? How often do people go into the first restroom in line, back out, and go into the third one? Well, maybe we need to be cleaning the restrooms a little more often during the day if we're having that many patients come through. Yeah. These are things that computer vision will catch a vision system, either computer vision or human vision, but no location-based traditional, wireless technology or infrared or something is going to notice details like that.
Wow. This has been a great final segment. Great question, Ali. I've certainly learned a lot from that. I didn't even think about that. So thank you. Well, I want to thank Todd, Ali, and Paul for your insights and perspectives today. 3 takeaways from today is RTLS 2.0 isn't optional. It cuts waste, improves safety, and gives time back to care teams. Second, I think you need to start small. Pick one workflow, set clear goals, and build trust early, especially with some of these emerging technologies like AI. And third, waiting to deploy RTLS costs more than you think. Lost equipment, worker burnout, and even patient risk. So with RTLS 2.0, we're driving staffing, safety, and patient flow across the hospital to facilitate faster decision-making. And that's beyond the blueprint. And I want to thank our audience members for listening today, and we look forward to seeing you next time. Thank you. Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.